by coming over here, we're able to expand our services, we're able to add a lot of new equipment, and we actually have another therapist that was in a different clinic in the Sandy area also that's joined us. That's Eric Passy.
The thing that we notice when clinics are in an integrated environment, in a physician office building, the communication with the providers is significantly improved. It's also easier to facilitate or get people into care. So the physician's clinic can walk somebody over and we can see them same day, which is really important, especially with a young, like, athletic population or some that has a deadline. They need to get better by tomorrow, by next week, whatever the case may be. So that's a significant improvement over being on an off-site facility.
Combining of the two clinics has given us a maximum from both of the clinics. The things that were missing in one clinic that were made up for in the other are now together, so we're able to do a lot of the things that we weren't able to do as single clinics together. For instance, a lot of the equipment that Eric had, he's brought with him, and we had some pieces of equipment also that he didn't have, and we've ordered new equipment. We also have gained some efficiencies with what we're doing. Our productivity is a lot more efficient, and patients can just come to one location now. Instead of trying to figure out which therapist in Sandy they're seeing, the therapists for Intermountain in Sandy are all now in this one location.
I love having the new equipment and the newness, the brightness of it. Windows. We didn't have windows at our other clinic, so it felt like a big cave. And also we have the ability to work together with a number of clinicians. So it's easier to bounce things off of each other so we can collaborate on patient problems, patient challenges, and so we have a great staff.
We definitely have a lot better opportunity for our patients in flexibility. There are more hours available for them. There are more staff available so that we're able to be a lot more flexible when they can come in. We have hours that start at 6 in the morning and go until 6 in the evening, 5 days a week, if we need it 5 days a week. So we just have a lot more flexibility by having the two clinics combined. Plus we have the expertise of 3 therapists now instead of 2. So I'll mention a couple of the services that we provide. One in physical therapy is we now have someone who is working with women's health issues and programs. She has specialized and certified in incontinence training, and so she's working with several different physicians specifically for that. We also have 2 occupational therapists who are certified hand therapists. So we provide that service. And we also have our speech pathologists located here in this particular office, where before they were separated from us in the same campus, but separated from our office. And so now all the services are provided under this one location.
Our range of patients is already pretty significant. So we treat people from, young, adolescent type ages, and our oldest person is probably in their, I think our oldest patient I've seen is 92. So
the best part about the new space is the opportunity for expansion. We were so limited in the old space, we're not able to grow, and now we have a lot more room for growth and expect to see a lot of expansion in programs, in other staffing as we move forward, in senior services, a lot of different places that we can expand now that we couldn't before.